Echocardiography is a simple test performed to assess the heart status. This could be in the form of heart muscles, whether the muscles are thick or thin. We could also assess whether what is the status of the heart valves. We can also assess whether there is any reduction in blood supply to a particular part of the heart. We can assess the enlargement of the heart chambers and also assess the pressure in various chambers of the heart as well as in the pulmonary artery, that is the artery which is supplying blood flow to the lungs. So, echocardiography is an integral part to estimate the functioning efficiency of the heart, that includes the heart muscle, heart valves, heart blood vessels and sometimes even an abnormal beating of the heart. The efficiency of the heart is assessed by a parameter called ejection fraction or EF. This parameter measures the amount of blood which is pumped out of the heart with every beat. This is the ratio of the blood which is present in the chamber and the amount which is pumped out. So, for example, 100 ml of blood reaches the heart, 60 ml goes out, so the ejection fraction is 60%. The normal ejection fraction is 55 to 65%. So, it indicates that even in a normal heart also the entire blood is not pumped out. Nowadays, ejection fraction less than 40 is called low ejection fraction. But even in patients with normal ejection fraction also, if the expansion ability is reduced, still these patients also can experience heart failure, which is called heart failure with normal ejection fraction. In a patient with heart failure, the doctor suggests an echocardiogram to understand the pumping efficiency of the heart, that is called as systolic function, the relaxation efficiency of the heart, which is called the diastolic function of the heart. They also will look at whether the heart muscle is thick or heart muscle is thin, what is the level of the blood pressure in the blood vessels supplying the lungs, that is, they are called the pulmonary arteries. They also look at whether there is adequate blood supply to all the parts of the body of the heart, and if there is a reduction of blood supply, that is manifested as wall motion abnormality, that means the part of the heart is not moving well, also called as in short RWMA. In addition, people can look at whether there is any abnormal special patterns of the heart muscle, and finally they look at whether there is any fluid surrounding the lung chambers. Heart failure is a common problem, the diagnosis of which is made by echocardiography. Those persons who have a reduced ejection fraction or EF can easily be diagnosed by the normal or standard echocardiographic examination. But in cases where the expansion of the heart is limited, in those patients the diagnosis needs specialized technologies involving either the Doppler or the 3D or sometimes some Doppler derived indices, and various chamber measurements have to be performed to determine the presence of a heart failure with normal heart pumping ability. In addition, we perform transesophageal echo when we cannot see the heart from above, then we go through the stomach and do the echo, or and then we have a special echo test called the do-between stress echo, where if the heart pumping ability is low, we can predict through this test whether the heart can recover with therapy or not.